Welcome to The Explainer. Today, we're digging into materials from a company called LifeActive Bio. They claim to have a technology that could completely change how we deliver everything from nutrients to medicine. So let's take a look and see what all the buzz is about.
To really get why a new technology like this even exists, you've got to start with a number. A really, really big number. The source materials point to a $3.2 trillion market for metabolic disease. And that's not just a business figure. It's a way of measuring a truly massive global health problem.
And behind that huge number is an even more staggering human cost. The source materials put it in really stark terms. Quoting the World Obesity Atlas, the number of premature deaths linked to this crisis is actually higher than from traffic accidents. Think about that for a second. It really puts the urgency for new solutions into perspective.
So, let's zoom in a bit. What exactly are we talking about when we say metabolic crisis? Well, the sources paint a picture of a huge, worldwide health challenge that's hitting billions of people in a lot of different ways.
I mean, these stats from the source materials are just mind-boggling. We're talking about 590 million adults with diabetes, 1.28 billion with hypertension, and 2.5 billion who are overweight. This isn't some niche issue. It's a full-blown global epidemic.
Okay, so this is where things get really interesting. To understand why this is such a tough problem to crack, the sources point to something we can call the delivery dilemma. It's all about the fundamental challenge of getting molecules where they actually need to go inside your body.
You know, when you swallow a pill, you think it goes straight to work. But nope. It has to survive a pretty brutal journey first, and one of the biggest hurdles is something called first-pass metabolism. Basically, your liver gets the first crack at anything you swallow, and it often breaks down a huge chunk of the good stuff before it can even do its job.
The source material uses a perfect analogy for this. Imagine you order a package, but at the main sorting facility, workers open it up and throw out half of what's inside before they even put it on the truck for delivery. That's kind of what first-pass metabolism does to a lot of medicines.
So, how do you get your package delivered without it going through that sorting facility? Well, the materials from LifeActive Bio propose a solution that just avoids it entirely. It takes a completely different route into the body.
So, what is MAP? In simple terms, it's described as this special substance, a microemulsion, that basically wraps around molecules. It's designed to act like a tiny, high-tech vehicle that carries its cargo directly through your skin and into your bloodstream, completely bypassing that whole digestive gauntlet.
Now, here's a really critical piece of the puzzle. A core claim is that MAP can activate the body's own nitric oxide production. And this is so important because nitric oxide is a bit of a two-faced molecule. It can go down a bad path, the obesogenic one on the left, which promotes things like insulin resistance, or it can go down the good path, the anti-obesogenic one on the right. The whole goal of this tech is to push the body toward that beneficial path.
And it's not just about nitric oxide. The platform is presented as having this whole suite of cool features. It's needleless, it uses ingredients that are generally recognized as safe, and it's supposedly tunable for different molecules. But two really big claims here are its ability to transport large molecules and this concept of polypharmacy, which is a fancy way of saying you can deliver multiple different active ingredients all in one single application.
Okay, the science sounds cool, right? But the big question is always, does it actually work? To answer that, the source materials dive into a detailed 90-day case study on one person to show the potential real-world results.
So this study follows a 62-year-old man. He used a LifeActive Bio product for 3 months, but not on its own. He used it as a companion to his GLP-1 medication, and you've probably heard of those. They're a really popular class of drugs for diabetes and weight loss.
And wow, when you look at the data table from the source, some of these numbers really jump off the page. You see big drops in weight, fat mass, blood pressure, and HA1C. That's a key marker for blood sugar. And at the same time, there's this absolutely massive jump in nitric oxide. Let's pull out a few of the biggest highlights.
First up, this one. A nearly 40% reduction in fat mass. And that is a huge deal. The sources really emphasize this because it's not just about losing weight. It's about losing fat while holding onto muscle. That's the holy grail in metabolic health.
And then there's this number, a dramatic 900% increase in nitric oxide. That is not a typo. It's a massive jump, and it ties directly back to that core scientific claim we saw earlier about how this platform is supposed to work.
And check this out, a 27% drop in systolic blood pressure. This is another key indicator of better heart health. We're talking about a change that can take someone from an elevated reading, kind of in the uh-oh zone, down into a much healthier normal range.
But honestly, maybe the most compelling part of this whole case study is what reportedly didn't happen. The source presents this long list of pretty common and frankly unpleasant side effects that are often associated with other metabolic treatments, stuff like nausea, GI issues, even hair loss, and says that this participant didn't experience them.
So, you've got the science, you've got a compelling case study. What's next? How do you turn this from a single product into something much bigger? Well, the final section of the source materials lays out the vision for this technology as a business platform.
And the company's roadmap is, let's just say it's not shy. It outlines this very ambitious, step-by-step plan to replace different kinds of delivery methods, starting with small molecule injections in 2025 and aiming to replace even oral pills by 2031.
So they're not trying to make every single drug or supplement themselves. The business model is all about licensing the technology out to other companies. The source materials lay out this clear, four-step process for partnering up with pharma, nutraceutical, and even cosmetic companies that want to use the MAP platform for their own products. And if you're wondering where the money goes, this chart makes it pretty clear. The focus is overwhelmingly on the science. Look at that. The biggest slice, 45%, is dedicated to research and development, followed by the legal costs of protecting all that intellectual property.
Okay, and we absolutely have to show you this. It's the standard but very important mandatory disclaimer that's stated directly in all of the source materials we reviewed. It's a crucial clarification for any product operating in this space.
So at the end of the day, the claims here are pretty bold. I mean, from completely bypassing the digestive system to delivering multiple drugs through the skin at once, it really leaves you with this one big question. Could a simple application that you just rub on your skin really redefine the future of medicine? It's definitely a space to watch.